Dean Lynn, president of Ocean Medical Center, primary sponsor. Actually, you're the presenter of our expo on Friday at the mall.
Yes, yes.
When I say the mall, Ocean County Mall, of course.
Yes.
It's good to see you. We had you here a long time ago.
It's great to see you, Bob.
And so we're so happy to have you back again with us at the mall. And you are the president of Ocean Medical Center. We talked about your background last time you were with us. And you like it. You like it here, right?
I love it.
You love what you do.
I love it. It's been great.
Yeah. And you're rather popular too among the staff there. I happen to know that.
Oh
well, I mean,
I'm glad to hear that.
I've asked people if they know you,
yes.
And I heard nothing but good. Now, there's been a lot of changes at Ocean Medical Center since the last time we had you with us. Tell us about some of them.
Yeah, well, first of all, great to see you again, Bob, and great to be on this wonderful radio show. Yeah, it's been a remarkable time at Ocean Medical Center. And just for your audience, Ocean is based in Brick, New Jersey, on the intersections of 80 and routes 88 and 70. We're part of Meridian Health, and it's been a great time. Just from a clinical point of view, we've been recognized not just at the local and regional levels, but also nationally for clinical quality. But we're growing, and so many things have happened. I spent a lot of my time talking about our emergency services. We're in the middle of a major construction project. Many of your listeners may, if they've been to the hospital, they would have seen a big construction project that's occurring in our backyard. It's going to triple the size of our emergency department, give us a lot more space and technology to treat people in their most vulnerable moments. So that's been great. Since we last met, we started publishing our wait times in an emergency room so that people don't have to show up and wait 3.5 hours. They can, check online and find out what the expected wait times would be.
Terrific. I'm sure last time you were here on my personal experience with your emergency facility, and it goes back some years before you had grown to what you are now, and I had nothing but good experiences there. Of course, I was never the patient. Right. I was always accompanying somebody,
yes,
which helps. But our overall experience at Ocean Medical Center has been great. I wouldn't expect you to remember, but I told you last time you were here that Marianne's grandson had this hideous, and I mean it was serious, ear infection. And he was, I started to say incarcerated, but he was admitted and spent several days there. That's how bad it was. And so we spent a lot of time with him. And the people, the doctors and on down, everybody was just marvelous. So I said, man, I'd stack Ocean Medical Center up against anybody. And so nothing but favorable experience. Now, what is the Center for Wound Healing?
So we've been, over the last couple of years, we've been investing in new services and just really trying to expand our outreach. So I'll give you, talk about wound care and give you another example as well. Wound care is a new service that we just launched within the past year, and it's really designed to help people, especially folks with diabetes, who struggle with healing wounds, to help them expedite their healing. So we have an expert panel of physicians that can develop a treatment plan for folks. We have 2 hyperbaric chambers that allow folks to essentially dive into and be surrounded by oxygen, which helps to facilitate the healing process. It's a great program, and it's really great to hear about people who are able to come in and can heal properly, because some folks just their wounds don't heal properly. That's been great, and so that's one example. I often tell people that at the core, a medical center is there to help people feel better faster, to get well sooner. But I can tell you that within Meridian and at Ocean Medical Center for sure, we're also very interested in helping people to live and stay healthy. And one of the things that we've been really focused on in the past year is bringing on new physicians. And as I mentioned to you last time, we have over 530 outstanding clinicians on our medical staff, and they've been trained in some of the best institutions around the country, and they've just chosen to live here in Ocean County. And we've been able to, in the past year, to bring on additional folks into our medical staff, just to help people have better access to primary care. That's one of the most important things, I believe, today, is to find someone who can basically quarterback your healthcare experience. And we have folks, Dr. Lisa Newman, actually here in Toms River, very close to your office here. She just had another physician join her, Dr. Zaharia. Dr. Verga is also in Toms River. A number of folks who really care about a patient's overall health and well-being. And like I said, when I use the word quarterback, it's really true. It's someone who can help people navigate a very complex health system, and because healthcare can be a very daunting experience if not, well managed. And so we have a lot of folks who can help with that process.
So many people who live here don't realize the quality of health care that's available to us in this area. We have so many implants come from New York City proper.
Yes.
So they think, oh, I've got to go to the city. I've got to go to this facility up north. It's right here. All you have to know is who they are. So many doctors have moved here from up north because they wanted to get out of that rat race, and they love the shore. They want to bring their families up here, and so I'm telling you, between Mary Ann and I, we can find a top notcher for any specialty. They're here. You don't have to run away. I also may have told you, I wouldn't expect you to remember this. Some years ago, Mary Ann had a terrible problem. I don't even remember what it was, but they sent her to Philadelphia, to Philadelphia, University of Pennsylvania. That's where you gotta go. And they gave her this test, her pancreas, an invasive test, and they nicked her pancreas, and she wound up 8 days in a community medical center with the nicked pancreas and had problems with it for years. And her attitude was, I could have had my pancreas nicked right here. I didn't have to go to the University of Pennsylvania for that. So, sometimes you're better off doing things close to home. In fact, that night we got home, they gave it a sheet to watch for signs of this and call us immediately. Well, I saw that she was in bad shape. So I called them, and I got the on-duty specialist who said, well, bring her back in immediately. I said, excuse me, I'm in Toms River, New Jersey. And they said, well, take her to your local emergency room. But, man, stay close to home if you can, because the care is here for you.
Yeah.
I'm telling you, you know that better than I do.
Yeah, well, a lot of times, it's truly, a lot of people see the grass as being greener on the other side, and in this case, the grass is much greener on our side, and people don't have to travel 60, 50 miles away. They can get great care, world-class care here, close to home. I just give you an example. A lot of folks, I know a lot of folks who live in this area, will look for total joint replacement, so that they've lived an active lifestyle, and then they get to the point where they need to replace certain joints, and so they can continue their life experiences. And a lot of folks will think that they have to go to the big cities to get great surgical care for joint replacement, and they don't. Ocean Medical Center actually is the top performing hospital for orthopedics, and we do so many cases, and our surgeons have been trained at Mass General in Boston, over in Georgetown, and different places around the country. And they, like you said, they've chosen to be here. And when you look at our clinical outcomes and our quality, it's basically as good or better than the big city hospitals. And yet, I do hear people, they want to have the cachet of going to the big city, but when you get a surgery like that, you need to heal. You want to be close to home so your family and friends can take care of you.
Look, I remember, again, last time you were here, I was very impressed. Your position as president of this huge complex, which started out as a little hospital, I thought it was a pie in the sky, a dream, and kept growing and growing and growing to where you are now. And yet you're obviously you're not stressed. You're not a stress. And I asked you about that last time you were here, and you said that the whole secret to your job is having good people. So you are able to delegate to people and know they're going to get the job done. You just seem relaxed in a stressed position. I find that enviable.
Well, Bob, you make me feel very comfortable in your show here, but certainly, yes, that's true. I have so many great people, from clinicians to just team members who, keep our hospital clean, and who help us with our billing and our case management. A lot of great people who really make our hospital work. And also, we're part of a big system called Meridian Health, which has a lot of resources so that we can do an even better job. And so it really makes my job a lot easier, and I can focus more on the future aspects of what we need to do. And but you're right, we have great people, and and the most important thing is that we all care about our patients. Every single patient comes in through our doors. We care about their experience. We want to get them to their best healthcare outcome with a great experience.
All right. Look, again, I want to thank you again for your sponsorship of our expo on Friday. And obviously, as the sponsor, you're going to have a very big presence at the expo. All sorts of screenings and et cetera, all sorts of information. So find out, folks, when you visit us, what it means to have Ocean Medical Center here right where we are. You don't have to run miles and miles to get the best care for anything. So it's a pleasure having you again.
Thank you.
And I'm not even going to ask if you're going to be there Friday. If you show up, we'd be delighted to see you.
I will be there.
You will be there.
Yes, I will be there.
Fine. So we'll see you Friday, and I'm looking forward to it. Thanks for coming in.
Thank you, Bob.
All right. Dean Lynn, president of Ocean Medical Center, and he'll be with us on Friday personally. And I hope you will be too.